Hello besties. So today we will be discussing about adhesive capsulitis, physiotherapy assessment and its management. So let's begin with the lecture. Physiotherapy management and assessment. So these both the things are very important for any physiotherapist. Correct assessment and as well as the management is important for the diagnosis of the disease. So let's begin with the assessment part. Physiotherapy assessment will include the subjective assessment of the patient. It remains same initially. What we have to do is we have to take the demographic details of the patient and then the chief complaints. Demographic details will include the name, the UHID number, and the age, the gender, the religion, all these things, plus the hand dominance of the patient. Along with that, we have to ask for the occupation of the patient, because there are a certain number of disease which occur due to the occupation or which have a higher risk factor. After the subjective assessment, we will take the patient history. In history, we will take the history of past illness and the patient family history. So in patient history, we will be taking past medical history. This will well rule out the red flags and guide the shoulder examination. So the past medical history is very important to rule out the red flags and to guide the shoulder examination thing in adhesive. History of presenting condition is very important. In history of presenting condition, we have to take the duration and the onset. For example, if the patient comes with a complaint of lateral side shoulder pain and the shoulder pain with the back ache a little, so we have to, it is very important for us to know the onset, date of onset, like the duration, from how long the person is facing the problem. So all these information will be included in history of presenting condition, in which we will be taking the duration, the onset, and all these things. Then comes the pain distribution and severity of the disease. In pain distribution, the patient with adhesive will complain of lateral side shoulder pain and the aggravating activities. For example, in adhesive, the patient will complain of limited reaching. The person will not be able to reach forward, and then the during the overhead activities, the person is gonna face difficulties like hanging of the clothes, and basically in the abduction activities, the patient will complain of pain. So these activities will be the aggravating factor for the pain. Then what we have to see is the therapist has to observe the posture and the positioning, the body alignment and the positioning of the patient. Scapular winging of involved shoulder should be observed from both the posterior and lateral views. So it is very important that we check for scapular winging of scapula. It's a condition, okay. Then we have to check for the range of motion, range of movement assessment. Range of motion we can check actively, passively, and by applying pressure, by resisting the range of motion. And then we have to see for forward flexion. So the patient will be presenting reduced forward flexion, reduced abduction, reduced external rotation and internal rotation. Along with that, the range of motion are key signs of frozen shoulder. So all these things we need to check within the patients of frozen shoulder. The shoulder joint has a capsular pattern. As I've told about capsular pattern in my previous video, which you can check out on adhesive. So what happens in adhesive is there will be a limitation of the shoulder joint range of motions into a capsular pattern, so according to which the external rotation limitation will be more than abduction limitation, and abduction limitation will be more than internal rotation limitation. So this is the capsular pattern which the involved shoulder of the patient will show. For example, the patient is complaining pain in the left shoulder, so we have to check for these range of motion. External rotation limitation should be the greatest, followed by abduction limitation and the internal rotation limitation. So all these things we need to check. Checking capsular pattern is very important. If you think that the patient may have adhesive, or to rule out adhesive, we must check for capsular patterns in the patient. Okay, then special tests are very important part and a very important tool for ortho physiotherapists. It is very important. The first special test we're gonna see is shoulder shrug sign, which is the inability to lift the arm to 90 degrees of abduction without elevating the whole scapula or shoulder girdle. So what happens in shoulder shrug sign is the patient will not be able to lift the arm in abduction. So when we will ask the patient to do abduction movement, he or she will not be able to do it till 90 degree without elevating the whole scapula. The patient will do some trick movements by elevating the whole scapula up, by elevation of the shoulder. They'll do elevation of the shoulder girdle and not just abduction. So we have to check for the trick movement. So it is the first sign which you have to check. Then there is this scientists who investigated the reliability of three functions related to test in patients with shoulder pathologies via a known experimental studies. So we have to check for the three functions. The first will be head to neck function. So in this, let me show it to you. This is what we are talking about. Head to neck, the patient has to touch. So here we are checking shoulder flexion, abduction and external rotation. So all these movements are we are checking these together. So in head to neck posture, what the patient has to do, the patient has to do shoulder flexion, abduction and the external rotation. So all the three range of movements are checked in this position. Similar to ADLs, like combing hair, when we comb the hair, what we do is some amount of shoulder flexion along with the abduction and external rotation is required for combing hair. So that's how we are gonna check all these three range of motion. Then we are gonna check for hand to scapula. So in this, the patient has to do a position like this, hand to scapula, touch the hand to the scapula. In this, we are checking for shoulder extension movement, adduction movement, along with that internal rotation of the shoulder. So all the three range of motions are checked in this. It is similar to putting on a jacket or getting into back pocket. So all these things are, or all these range of motion are important to be assessed. Then we check for hand to opposite scapula. So here in this, what we are gonna do is tell the patient to do to touch the hand to their opposite scapula. So in this, what we are checking is shoulder flexion along with that horizontal adduction. If a patient is unable to complete the motion, other structures outside the shoulder joint may be the limiting factor. So all these three motions, three range of motion, or all these three activities we are going to tell the patient to do. And then if the patient fails in doing so, then there may be some other structures which may be not appropriately, or there may be some other structures involved pathologically, which may be the limiting factor to these activities. Then in the assessment, we check for the movement. In movement, we check for the global loss of active and passive range of motion. So what we are gonna do is, in adhesive, I've already told you that adhesive capsulitis is a progressive loss of both the active and the passive range of motion. So for movements, what we are gonna check, we are gonna check for the active range of motion of shoulder and the passive range of motion of shoulder. And there is gonna be the global loss of both of these range of motion. Pain at end range in all directions. The patient will complain of pain at the end range of the range of motion at the joint. In adhesive, the onset of adhesive, we have to check for the age of the patient. If the age of the patient is 35 plus, then we may suspect a case of adhesive. Physical therapy management. Okay, so now we will be studying about the physical therapy management, how we are going to manage a patient with adhesive capsulitis. For example, there's a patient who is in 40s and who is coming to us with the shoulder pain and is complaining that the pain is in the lateral side of the shoulder, and he's not able to do overhead activities like combing hair, etc. and etc. Then we can suspect that the patient may have adhesive. So for that, what we have to do is, the first step we have to do is to assess the patient. In assessment, I have told you to we can check for the special test, the movements, and we can check for the range of motion, the scapular winging, we can observe the posture, we can see for the capsular pattern. So all these things need to be done for the assessment. And if we successfully assess the patient and come to a diagnosis of frozen shoulder, then the protocol, the physiotherapy protocol which we are going to follow, let's discuss about that. Patient education is very important. A therapist should educate the patient about the condition and what will be the prognosis and everything. Then PNF exercises plays a very important role. A patient with frozen shoulder can be instructed to do PNF exercises. These are very effective in decreasing pain, increasing range of motion, improving function, and then reducing the disability. So a PNF can be suggested. Then in the initial phase, which is painful and freezing, pain modalities are applicable. For example, the patient is coming with an acute case and is an acute case of frozen shoulder. Then it's not that on the very first day we are going to tell him to do the PNF exercises. No, it's not like that. First, what we have to do is we have to reduce the pain of the patient. So for that, we have to manage pain by giving modalities such as TENS or hot pack or ultrasound and massage. So all these things are suggested in the initial stage to manage the pain of the patient. Once the pain start to decrease, only then we can implement the exercise protocol. Okay. Stretching exercises are very helpful, because in adhesive capsulitis, what happens is the capsule it develops adhesions and fibrosis. So for that, stretching of the capsule, stretching of the joint is important. So yes, it is very important for the management of frozen shoulder. Then the isometric strengthening of the muscles of shoulder girdle. Then for the strengthening, we suggest for the isometric exercises. That in the initial stage, what happens is the patient complains of pain. So you can just suggest for these cordman exercises. So this is a pendulum exercise in which the patient has to do uh, forward flexion and then extension. In this, the patient is doing flexion and then extension. So this is the pendulum like movement in which the patient has to rotate the hand, and it is assisted by the gravity. So in the initial stage, we can implement these exercises, the cordman exercises, or we call them as the pendulum exercise. So in this, what the patient is doing is adduction and abduction movement. Both of these movements are assisted by the gravity. Then in the second phase, the range of motion is decreased. So what can we do to increase the range of motion is we can go for the mobilization techniques. For example, the Carlton bond mobilization, and then the Mulligan mobilization, and the Maitland mobilization. In Maitland, we can go for the grades, like initial stage. In the initial stage, we can go for grade 1 for pain and spasm. Grade 2 is also for pain and spasm. So mobilization can be implemented. Then acupuncture and dry needling, mobilization with movements. Then the stretching. In the second phase, we will include stretching. In first and second, both the phases, stretching is included, and it is very effective for the cases of frozen shoulder. Then the goal for end range mobilization is not only to restore joint range, but also to stretch contracted prearticular structures, whereas mobilization with movement aims to restore pain-free motion to the joint that had antalgic limitation of range of motion. So mobilization with movements is very effective. It restores the pain-free motion, and the it restores the joint range of motion. Then the third phase is the resolution one, in which the strengthening exercises are implemented. In strengthening, we can go for the PRE exercises, progressive resistive exercises, in which we can strengthen the muscles of shoulder girdle with the help of therabands, with the help of weight cuffs and everything. And these exercises will increase the range of motion eventually. As the patient's irritability level reduces, more intense stretching and exercises using a device such as a pulley can be performed to influence tissue remodeling. Exercise protocol for frozen shoulder. So now we will be discussing about the exercises which we can include in the management of the case of frozen shoulder. The first will be the wall climbers. So here, what the patient can do is, or the ladder exercises. In this, the patient has to stand by the side of a wall, and then the arm should be in abduction, and the patient has to just roll the hand in the position of abduction on a wall, against a wall. So these are the wall climbers, or the wall ladder exercise. It can be done on this kind of ladder, in which the patient is having her shoulder at the flexion level, and then in the flexion these are to be performed. So shoulder ladder can be done both in abduction as well as in flexion. So this you must remember. Next, the patient can do assistive exercises by the assistance of a wand. So in this, the second image, what the patient is doing is She is doing internal and external rotation with the help of the wand, and here she is doing the same. And here in the third image, the patient is doing extension of the shoulder. Flexion, first image is showing the flexion of the shoulder with the help of assistance of the non-affected hand. So the patient is using the non-affected hand to take the affected hand into the shoulder flexion range of motion. Here she is doing external and internal rotation, and here she is doing extension. These are some of the PRE. With one hand the patient is resisting, and with the other hand the patient is doing the movement. For example, with this hand the patient is putting resistance and trying to do the shoulder into a the abduction movement. This is also known as the pulley. So with the help of a pulley, the shoulder flexion can be performed. So here in this, what we gonna see is the adhesive capsulitis exercise protocol, in which we will be seeing the this everything is done in adhesive capsulitis exercise protocol. See, look for the first image. In this, the patient is doing passive forward flexion. So in passive forward flexion, the patient is using a wand. This is the wand, and by holding the wand from the right hand, the hand which is the non-affected one, and holding the wand above from the affected hand, the patient has to do what? This movement. The patient has to put the the ladder, and then the frequency of these exercises will be 3 sets of 10 repetition. So 10 repetition are to be done, and this is to be done 2 to 3 times a day. This exercise is increase and maintain the shoulder range of motion. Then in second image, we can see the passive abduction. Grasp the end of the rod with one hand, and the other end with the hand 2. Use hand 2 to passively raise hand 1 up to the side until a stretch is felt. Hold the stretch for 10 seconds and return to starting position. Repeat it for 10 times. 3 sets are to be done, and this is to be done 2 to 3 times a day. It increases and maintains the shoulder range of motion. Then the next exercise is passive external rotation. The protocol is same. Grasp one end with one hand and the middle of the rod with the second hand. Now use hand 2. This is the hand 2. This one is the hand 2. So the patient has to use the hand 2, passively rotate hand 1 to the side while keeping the elbow in. So the elbow has to be kept in, and then passively rotate the hand. So what happens by this action is this hand goes into this hand goes into external and internal rotation in adduction, not abduction, adduction. Then the next is the forward wall climbers, which we have discussed. So here the wall climbers are to be performed in flexion. Here the wall climbers are to be performed in abduction. Then the isometrics. What we have to do in isometrics is we have to push the shoulder backwards. So when we are pushing the shoulder backward, we are doing what? We are strengthening the extensors. In this, we are strengthening the flexors. Then the isometrics for abduction and adduction. Here we are strengthening the abductors, and here we are strengthening the adductors. Scapular retraction exercises. We have to just squeeze the shoulder blade. Relax the head and neck, stand with a good posture, squeeze the shoulder back, and avoid the shrugging of shoulder. Keeping the abs tight, we have to hold the position for 10 seconds and then relax. Repeat 10 times. Alright? 3 times a day it has to be done, and it increases the strength of scapula muscle. Then what we have to do is scapular elevation, which is the shoulder shrugs. Relax head and neck, stand with a good posture, squeeze shoulder up towards your ears, elevate your shoulder, and then keeping the abs tight, we have to hold this position for 10 seconds and then relax for 10 seconds. External rotation and then the internal rotation with the help of therabands. So I hope with this you guys are clear with the adhesive capsulitis management physiotherapy protocol. If you have any doubt, please write it down into the comment section. Thank you so much for watching my video. Please hit the like button, subscribe to my channel. Thank you.